This healthy living tip is brought to you by the Christ Hospital Health Network.
Heart failure is a condition in which the heart's ability to pump or fill with blood is impaired. This often leads to symptoms of congestion, which include the lungs filling up with blood, as well as the body, including the legs and belly, filling up with blood. It also leads to symptoms of what I call low cardiac output. These are symptoms of chronic fatigue, lack of appetite, as well as not being able to feel like you have the energy to do things you're used to doing. Your first step is to see your primary care doctor. The primary care doctors in the community often are very skilled at taking care of the initial stages of heart failure. There's many medications that have been proven to help patients live longer that are very simple blood pressure medications. The Christ Hospital has a dedicated treatment center for heart failure, and very lucky and fortunate to have this. It's a dedicated unit of 28 beds, a telemetry floor in the hospital, which is staffed by nurses that see heart failure patients all the time, year-round. The nurses are really the gem of that floor because they spend the most time with the patients, providing a lot of education to these heart failure patients. Lifestyle modifications are important in terms of managing this chronic disease. This includes diet. We often ask our patients to comply with a low-sodium diet, less than 2,000 milligrams a day, as well as we try to have them fluid restrict themselves to some extent. Heart failure is a condition that is very manageable. We have patients living longer and more active lives with heart failure all along the way. The treatment of heart failure starts with medications, and these medications can actually help the heart heal and beat stronger and inject more blood through the system. However, with time, unfortunately, these medications stop working as well as they should, and patients often end up needing to come to the hospital for more advanced treatments. I think a lot of cardiac patients have resigned themselves to a less than desired quality of life. And I often tell my patients, get out there, go do what you want to do. If you're not doing what you want to do, come talk to me, because then there's lots of things I can offer you, different medications we can tweak, different surgeries, as well as, if need be, advanced heart failure therapies such as left ventricular assist devices. LVADs are surgically implanted mechanical devices that assist the heart in pumping blood throughout the circulation. These LVADs are offered to patients with advanced heart failure symptoms. These are patients that have lived with chronic cardiac conditions for many years, often going through multiple angioplasties, heart failure, hospitalizations, cardiac surgeries, and really they're at the point in their disease process where they need a more dramatic way to intervene on their heart and the heart's ability to pump. LVADs have been shown to help patients live longer and more active lives. If you have heart disease in your family, there are ways to modify your lifestyle to help prevent the heart disease to afflict yourself. And I think one of the most important things is to stay active and to exercise. Along with those, diet is very important. We often recommend a Mediterranean-type diet. This is low in carbohydrates. It's rich in proteins, specifically getting your protein from fish and poultry. We like to try to avoid diets rich in red meats. The Christ Hospital feels it's important to stay up top on research protocols, and we think this really helps provide patients in the Cincinnati area with the cutting-edge medical treatments and technology that we think is going to help them live longer and better lives. I feel very fortunate to be part of the physicians at the Christ Hospital, in particular the physicians and nurses, as well as all healthcare staff that's part of the Advanced Heart Failure Treatment Center there at the Christ Hospital. I think it's a very dedicated and intelligent group of people that really are looking out for the best interest of the patients at the hospital as well as the people of Cincinnati.
Call 585-1000.